will summarize the person-centered approach that was developed by Carl Rogers in the 1940s. Carl Rogers also developed the non-directive counseling approach. Rogers viewed the traditional roles of the therapist and the client to be flawed. He felt that the true personal growth could be better achieved through allowing the client to lead the therapeutic relationship, to be in charge. Prior to this, the traditional belief for therapy was more of a doctor-patient relationship. Carl Rogers' person-centered view was that therapists and clients should have a personal relationship, that clients should truly like their therapist, and vice versa. The therapist should really have an empathetic, genuine a positive regard for their client. Rogers believed that humans naturally move towards being whole and actualized. He followed Abraham Maslow's actualization theory, and he felt that that's how true personal growth could be achieved, was through a therapeutic process that was friendly, was genuine, was empathetic, and was focused on personal growth. He felt that each person had the ability to move towards growth and change, that we do it naturally. Person-centered theory comes from a non-directive approach, meaning that the therapist doesn't direct the therapy, doesn't start with a therapeutic goal like we do in some treatment plans, but starts with the idea that the client identifies the problem and the goal that they want to work on. So the client is directing the therapy, not the therapist. Therapists reflect and clarify the client's feelings, which leads to the client truly feeling as if they've been heard and understood. This is the process of active listening. Rogers believed that people have the right to be accepted, and the only way for an individual to experience true growth lies in that empathetic relationship with their therapist. He felt that by experiencing acceptance, clients are able to gain insight into their own problems. Once a person has some understanding of their problem, then constructive action can be taken. Once a person truly feels like they've been listened to and that they are truly liked, they're more likely to open up in therapy. The person-centered approach rests on the basic trust in people and in their tendency towards moving towards actualization. So not only does the client need to have trust in the therapist, but the therapist needs to be able to trust the client. Carl Rogers said that it has been my experience that persons have a basically positive direction, meaning that he felt that most people have a positive direction that they want to move towards. Person-centered therapy shares some basic concepts with Gestalt group therapy and existential group therapy. They all come under the humanistic umbrella. All three therapies emphasize self-awareness as a key role in order for individuals to make life-affirming choices. They also share a strong commitment to the uniqueness and individuality of the person. Those theories seek to actualize their clients. There's a strong belief that humans are self-determining, and although people are influenced by their past, they're free to choose their present and their future. Lastly, humanistic therapies share a genuine concern and respect for the person and their unique experiences. These theories emphasize that people are capable, and are capable of making their own choices, and of acting responsible and caring in their relationships. Person-centered therapy rests on 6 factors that Rogers identified in order for a person to have growth. He said when these conditions are met, the person will move towards actualization. The first condition involves a therapist-client relationship. He said the relationship between a therapist and a client must exist in order for the client to achieve personal change. This goes back to his idea that therapists need to be involved with their clients. The second factor is client vulnerability. It's the idea that there must be a discrepancy between the client's self-image and their behavior or their experiences. And that discrepancy leaves them vulnerable to their fears and anxieties. That's why they come into therapy. The third factor involves the therapist's genuineness and congruence. The therapist should be self-aware, genuine, and congruent. They should understand themselves within that therapeutic relationship, but they should also be genuine and congruent with the client. The fourth factor is the therapist's unconditional positive regard for the client and the respect that the therapist should have for the client's experiences. A therapist should accept the client's experiences without judgment and with a positive, accepting attitude. The fifth factor is therapist empathy, and this is a really important factor. The idea that a therapist has an empathetic understanding of the client and their experiences, and recognizes that emotional experiences without getting emotionally involved, in a way being that client's mirror or that reflection, with the ability to empathetically reflect back to the client. The sixth factor is client perception. The client needs to be able to perceive that the therapist has that unconditional positive regard and feel that the therapist has an empathetic understanding. This comes through the words and the behaviors of the therapist. Person-centered therapy can be used in a group. And just as Rogers believed all of the individuals tend to move towards growth, he also felt that same way about groups. He said that therapists should trust that groups also will move towards a positive potential. As people start to feel part of the group, they realize that they are part of something bigger, and they tend to get focused on that goal, those group goals. Therapists take on a role of facilitator rather than a therapist, and as with individual therapy, they set those conditions or that environment for growth. And they have to be much the same as the 6 factors that we've already mentioned. The idea that individuals have grown when they feel genuinely accepted by an empathetic person is also translated into the group. When the group sees the facilitator modeling empathy and genuineness and positive regard, then the group starts to reflect that as well. Rogers knew that groups have the same potential as individuals to move towards positive growth. He also acknowledged, though, that there are differences in group members, and sometimes those differences can lead to some anxiety and some irritation. He felt that teaching people how to have that attitude of grace helps to alleviate some of that. He felt it was also necessary for the group to be in charge, to determine how best to use their time. And he would often start out groups with things like, what should we talk about today? It gives the group autonomy and choice. And when people feel that they're in control and they have choice, they react more positively, and they have growth. Group members have the ability for positive movement without the facilitator taking on that active role, that directive role. Groups direct themselves. And in that regard, the facilitator has to have basic trust in the group, and the trust that the group has that ability to do that. And in so doing, group members are selected for the group basically because both the member, or the potential member, and the therapist agree that that person will get some kind of benefit from joining the group. Traditional person-centered groups have no official orientation with the facilitator giving ground rules. That was Rogers' idea. Okay. It's since changed a little bit. His daughter changed it up a little bit. Natalie Rogers actually came up with some other ideas on how to set up a group, and she works with expressive art therapy, and in that expressive art therapy she gave some guidelines. Now those guidelines are things like, be aware of your feelings in your body, take care of yourself. This is good advice, not just for the client but also for the therapist. She said there's no right or wrong way to do art. Just like in art, there is no right or wrong way to make decisions. In the group, if the group comes together and makes some decisions, then we have to respect their experiences and their decision making as a facilitator. She said instructions are suggestions. Otherwise, be your own boss. The group needs to be in charge. That is that non-directive part from the facilitator. She said these experiences that they may bring up feelings, and it's okay to cry or to make sounds or noises of frustration or whatever it is in order to deal with their emotions. And then lastly, she said, if you want to just observe, it's okay. Take notice of how the group dynamics are. Enjoy the experience. Don't judge others, and keep the boundaries for confidentiality. Although those guidelines are found in her expressive art therapy, which is based on the person-centered therapies, I feel like they could be applied towards any group therapy and any personal-centered therapy today. Person-centered groups may meet weekly. They can meet for about 2 hours or a little bit more even. Some of Carl Rogers' groups met on the weekends or for a weekend getaway, and sometimes for a week and sometimes a little bit longer in a residency community, a small group community program. And because of that, it allowed for small growth communities so people could learn to trust one another because they were living together for a week or more. Some of the strategies that Rogers identified that could assist with the group process, and were talked about in our text, were things like encourage members to express feelings and expectations in an open manner. That goes back to the guidelines that Natalie Rogers talked about. Teach group members how to focus on themselves and what they're feeling. Pay attention to what you're feeling. Create a safe environment that encourages risk-taking. Support members as they try out new behaviors. Foster member-to-member interactions. Respect people's experiences. And allow members to interact with each other and not just interact with the facilitator. And help members to overcome communication barriers. Some people will have a difficult time communicating with others, especially in the beginning before they make those relationships. And assist and encourage members to assess that group's process every once in a while and make changes as needed. It's okay to modify or to make changes as they go. Person-centered therapies include applications for educational settings, and Rogers worked with schools. There could be applications for effective and cognitive learning in workshops with teachers to teach teachers how to be empathetic, accepting facilitators in their classrooms. And it's also helpful in organized development and leadership. Because the therapeutic conditions of genuineness, empathetic understanding, and unconditional positive regard are so straightforward and they're easy to apply, even those without training are able to benefit. Since the approach places the power in the individual instead of the therapist, once taught, then the individual can then turn around and use those same skills in their own personal setting. In 1994, Rogers and Freiberg wrote a book called Freedom to Learn. And this book applied person-centered therapy to the educational setting. It described a foundation for using person-centered theory in order to change traditional schools into places where children were free to learn, to choose what they wanted to learn. And the teacher-student dynamic, it was dramatically changed from teacher-student to more of a facilitator and students. Rogers worked with schools to implement his person-centered theory into their environments. In a person-centered environment, teachers become facilitators of learning and students learn to make decisions about their learning. The Montessori models are based a little bit through the person-centered environments. Students develop that ability to work cooperatively and responsibly and are self-directed, which translates to better employees later on in life. Teachers focus on being genuine, empathetic, and caring. And since students learn to be self-directing, they take responsibility for the consequences of their choices. Person-centered therapy hasn't just been used in education. One study I found talked about how it was being used in military applications, because the important function in goal-focused military settings is to create safe settings for military members to gain therapy, and it's had such a stigma in that society or in that environment. The person-centered applications of having a non-judgmental nature and valuing the perspective of the client have become rather popular. Person-centered therapy facilitates a therapeutic relationship, and it supports the military person with empathetic responses and that unconditional positive regard. The client defines the problem, In an environment where the attitude towards using mental health services is seen as a weakness, person-centered therapy can be helpful to those returning from combat deployments by addressing things like moral injury and repairing relationships, since they have such a hard time accommodating back into, or assimilating, I should say, back into their personal environments with their families. It can also help with coping with those psychological challenges of PTSD and of adjusting to the non-combative roles. Carl Rogers' person-centered therapy has a natural propensity for diversity. Carl Rogers began with individuals. He began with individual therapy, and then he soon branched into group therapy, and he saw the applications there working, and then finally he started developing community workshops, because he felt like his theory couldn't just be used in the person-centered therapeutic group, but outside of the therapeutic environment. Why not in business applications? Why not in team groups? Why not in the military? Why not reach out and work with world peace? Carl Rogers obviously had some very strong and very wide-reaching views of the world. He recognized that those basic foundations of person-centered therapy have a much broader application, and he drew on that towards using his theory to reduce human suffering and conflict resolution on an international scale. In fact, one of the things that he said was that the only way to understand another culture is to assume the frame of reference of that culture. He felt that in order to truly be empathetic with another person, you needed to understand where they were coming from, and that includes from their culture. The idea of listening to others with the attitude of grace and genuineness and empathy and that unconditional positive regard isn't only valuable in that therapeutic environment. Imagine what would happen if world leaders actually listened to each other with this exact type of attitude. Rogers applied his theory in his search for ways to address the psychological barriers in communications between differing world factions, and he felt that world peace lies in positive communication. In looking at the person-centered approach, I find that it's an excellent tool to build the foundation of any kind of group. The approach encourages members to take responsibility for the group's direction and goals. I like that the approach teaches the skill of active listening, and when it is practiced by the facilitator, it can actually lead to a deeper understanding of the members' worlds. I appreciate that empathy and genuineness are cornerstones of the approach. As Rogers said, when a person realizes he's been deeply heard, his eyes moisten. I think in some real sense he is weeping for joy. It is as though he were saying, "Thank God somebody has heard me. Somebody knows what it's like to be me." There is a strength in that. There is no denying that true empathetic listening and genuineness are powerful, life-changing tools. The tenet of unconditional positive regard for others is also so powerful. It's hard to obtain within that therapeutic therapist-client relationship, simply because often we are limited in the amount of time that we have with our clients. I realize that maintaining that Rogerian environment is not always easy, because it is human nature to judge. And within groups, you're not just dealing with your own prejudgments and your own biases, but you're also dealing with other people's judgments and biases. However, therapy should be a place of safety, and it should be free from judgment and bias. And although there are times when confrontation, I think, should be used, if that environment has already been set so that that client feels that they are truly understood and they are actively listened to, and there is true empathy and true genuine regard for that person there, they're more likely to be more positive when confrontation does need to occur. They're more likely to listen to you. I believe that adopting the person-centered approach as a therapist is beneficial. And I think as a future therapist, it's one that I have always thought should be my attitude. And I always look at working with clients as an attitude of grace. Today I am a case manager, and I work with a variety of clients. And with each one, I try to do exactly what Carl Rogers said. Be empathetic, be genuine, and also treat them with a positive regard. Thank you.